it's quite potent, effective, but has more side effects. So there's a balance there, but most people can tolerate it very well. Yeah. Yeah. Yes.
I've heard that some or one beta blocker can be effective with assisting or helping prevent migraines. Is that true? And if so,
Yeah.
which beta blockers?
Yeah, there's 5 beta blockers that work for migraine, we think. And the most commonly used and maybe the most effective is propranolol, or Inderol was the old name. And timolol is also very effective, but it's very hard to get these days, and tends because it doesn't have not enough people who are using it. And what happens if not a lot of people use it? It just becomes expensive, because the companies don't want to manufacture it unless it's expensive. But metoprolol is probably the other very common one, and then atenolol and nadolol. Atenolol and nadolol, and there's another one, but I'm having a what? That's not a beta blocker, but that is effective for many people, and that's a very nice medicine to use for a migraine patient.
Did she say it's orthostatin?
No, candesartan. Candesartan.
Thank you.
Yeah. Yeah. Okay. I'm dismissed.
Okay, we're going to start up. Did everyone do the pre-survey? Raise your hand if you did not do the pre-survey. You did not. I don't know. Is it too late to do the pre-survey?
I can do it online, right?
You have to do it before we go to the next session.
No, okay, because I have visual problems.
Oh, you do? Okay, well then, I mean, can you do it on your phone, or is that too uncomfortable for you? You don't have to do it. It's really fine. Okay. All right, so we are going to do something very interesting in the next session that we actually do in an advocacy training program that we have at Miles for Migraine called ACT Now, where ACT stands for Advocacy Connection Team, and it's a training program for physicians and patients. And so you can go to our website and check it out later. Some of us here have been through the ACT Now training program. Raise your hand if you went through our ACT Now program. Okay. It's a form of advocacy to learn about advocacy, and it's something that you can go and look at later. And the reason I'm bringing this up is because it's very important to, once you leave here, to understand, which you will understand as we go into the next 2 sessions, why advocacy should also be part of your treatment plan. And we're going to learn how to do an elevator pitch after Deborah Turk speaks to us in just a minute. And the reason that's important is because we talked earlier when Dr. Seebach talked about wearing the mask and not talking about migraine or headache disease, because the fear of the retribution that you feel and the stigma. And when I was first diagnosed with migraine, I didn't even know what migraine stigma was. I was 25, and no one sat me down and said, well, people are gonna not understand this disease for the rest of your life, and you're gonna have to hide it, because if you tell your friends, families, bosses, co-workers, they're not gonna understand. Or they're gonna say, oh, well, I would never hire that woman because she has migraine, and she's probably gonna miss a lot of work. So that's stigma. It's important for us to use our voices and to go out into the world and talk about migraine and headache diseases if we're ever going to get a cure. It happens with breast cancer. When I was a little girl, I remember my mother and her friend standing in the kitchen because one of the ladies had breast cancer, and they were whispering, and I had no idea what they were talking about, and eventually my mom told me. Back in the 70s, no one talked about breast cancer, and we never said the word breast, and so now we say boobies and tatas. So how about that? So that's what we need to happen for migraine. We need more people to talk about it so it becomes a household word. So Deborah Turk is an amazing patient advocate. And she has been with us at the very beginning, at the very first race back in 2013. I think it was 2013. She lives with intractable migraine, and she has been drawn to wanting to help people. Deborah has held employment in the fields of nonprofit human services and behavioral health. Due to increasing debilitation from migraine disease, after medical leaves and continual decreases in her working hours, she was forced to leave a career that she loved, working with patients and dual diagnoses related to substance abuse disorder and mental health. Deborah began her journey with Miles for Migraine at the first Philadelphia race, shortly thereafter observing the hesitancy of those living with migraine to speak openly about their disease. Deborah started a public Facebook page called Her Migraine Life, which I suggest that you all check it out, on which she openly shares about her experiences related to migraine. She is passionate about education, self-advocacy, and especially countering migraine stigma. Deborah is a Philly native. Deborah.
Hello, everyone. I'm thankful for every one of you that stayed. Okay. What is an elevator pitch? Shirley told me somebody would be doing this for me, and I think it's this way, right?
What?
This way, right?
Well, you can use that clicker.
How dare you expect me to be coordinated? Okay. Okay. So the first slide, what is an elevator pitch? So an elevator pitch is a concise, compelling way to introduce yourself and the subject in a short time frame. It's also a form of self-advocacy. Of course, elevator pitches are not exclusive to migraine. If you go on YouTube and you type in elevator pitch, you're going to find a whole bunch of videos of people instructing us on how to construct an elevator pitch. But basically what they have in common is you want to grab your audience's attention, and you want to make sure that when you do, within that period of time, you convey the significance of your topic. An elevator pitch is named such because we're trying to have this talk within the average time that you would ride an elevator, so that would be between 30 seconds and 2 minutes. 2 minutes is on the long side for an elevator pitch, but as long as you keep it under there, that's what we're aiming for. Why do we need an elevator pitch? Well, as migraine patients, we need elevator pitch because migraine, I'm sure we all know in this room, is more than just a headache. Outside of this room, in the world at large, it is still largely thought of as just a headache. And because of this prevailing attitude, to this day, migraine is still misdiagnosed and underdiagnosed. And also, this is a contributing factor as to why migraine does not receive the needed and deserved treatment, funding for research. And we need to change that. How are we going to change that? By reframing the perception of migraine and headache diseases. Because our goals are to increase diagnosis, research, and to reduce the insurance barriers that so many of us are burdened with, and ultimately to come up with a cure. But how are we going to do that? Through self-advocacy. I say all the time, no one is going to advocate for us. We have to be our own best advocates. And crafting an elevator pitch is a good way to begin your migraine advocacy journey, or a great way to further it. Step one. Step one is start with a greeting. More often than not, there will be a lead-in to this conversation. So you're not always going to have a greeting with someone. But however, remember through this process, you're tailoring it based on with whom you're speaking, or whatever the situation is. So for instance, if you're talking about a conversation that starts itself, say you're at work and someone says to you, I noticed that you seem to wear those glasses with those amber lenses inside all the time. Why is that? Well, then that's a perfect lead-in as to you can now go into your elevator pitch and let them know, what are these glasses for? What happens when I don't wear them? What effect the fluorescent lights have on your eyes? Next slide. It's a coordination thing. Step 2, state your condition. So, of course, you clearly want to state that you have migraine. You don't want to start off the conversation with, I have headaches. So, it says that I want to speak with you about something important. Of course, like we said, this is all based on the situation and what the purpose is as we're going into this conversation. So when I see an example like that, where there's like an introduction, I kind of think of that as like if you're going to have a conversation with HR, human resources, or maybe you're having a conversation with someone who wants to involve you in something that takes a level of commitment. And so you want to then sit down with them and have a talk about, the fact about you have migraine and how this can affect your level of commitment and your ability to participate in whatever the situation is. Crafting your, excuse me, please. Oh, and I meant to tell you guys this at the beginning. All day I have been fantasizing. I've been fantasizing about my ice cat because I do not feel well, and I did take an abortive this morning. So if I seem to be struggling with a thought or I forget what I'm saying in the middle of a sentence, that is why. So, okay. So we're going to describe what migraine is. This is just going to be a really brief explanation. Don't worry about getting all scientific, when you're talking about migraine. Some people know nothing about migraine. So then you're going to definitely let them know that, what migraine is. It's a complex neurological condition, and it usually has some of these symptoms. But step 3 and step 4 can actually sometimes be combined. So as we go on to step 4, we're now going to talk about our personal experience with migraine. So, meaning we're going to share our experience, which will include the symptoms that we live with. So, for example, if I'm speaking to someone and I'm letting them know that I have chronic migraine, then I can let them know as well. With my chronic migraine, I experience severe fatigue almost constantly. So this really gets in the way of my productivity and the things that I'm able to accomplish. So tonight, I'm going to go mop my kitchen floor. That will be the limit of what I can do because that will wear me out. That's the effect that the fatigue has on me. And this is from one of the symptoms of chronic migraine. It's important that when we're talking about the symptoms of migraine, that we definitely share our symptoms, because even though the disease has certain hallmarks that are, shared by most, the disease is still unique to each one of us. So we definitely want to make sure that we share how it affects us. Mention your triggers. Okay. We do not all have triggers. So do not feel pressured to include triggers in your elevator pitch. If you know about things that exacerbate your migraine symptoms, such as fluorescent lights, or things that are triggers for you, such as changes in barometric pressure, then you definitely will want to mention them. Step 6, express your needs. Let's face it, there's lots of ignorance out here about migraine and other headache diseases. So how will folks know what we need unless we tell them? We shouldn't get angry when people say things, express things about migraine out of ignorance. We should be determined to use each opportunity to educate. Let's say when we're speaking with people in our private lives, like our family and friends, that's a good time to introduce the spoon theory. Anybody here who doesn't know what the spoon theory is? Yeah? Okay, you're gonna help me, make me say something I didn't prepare for. But basically, the spoon theory is, and you can look it up later to get a more thorough explanation than the one I'm about to give, is that you have a certain amount of spoons. Let's just say you have 10. Okay, I'm gonna just say 5, since I have, So you have 5 spoons, right? And then for each activity that you have, or whatever thing that you have to do, you have to remove 1 spoon. By the time you get to no spoons left, you have nothing left, and you're done. So your spoons are non-negotiable. So when you are speaking to your family members, maybe there are some unrealistic expectations that some people may have of you, and they really don't get it. So the spoon theory, the woman that came up with it, I remember reading about how she came up with it and how she shared it with her girlfriend at like lunch or something, and it really turned things around as far as understanding that this is not something that, we're choosing to do, that normally, it's not about our willpower. It's about what we have and what we don't have. Spoons are gone, it's a wrap, I'm done. Okay. Step 7, offer resources. You definitely want to leave them resources to learn more about migraine. Share websites, share articles, share education events. This is really important because you really want them to understand. Remember, this is a short conversation that we're having here. So there are people that are going to want to learn more. Depending on what the situation is, like if you just have like a little bit of time, you can shout out to them, you know what, look up migraine.com. That's something that people will remember. But if you have more time, maybe you can write some down for them. Write down a couple of organizations, CHAMP, National Headache Foundation, things like that. Or use technology, use your website on your phone real quick. I know they have this thing, I know iPhone people, you can just go like that and the link will be transferred or whatever. I don't know, I'm team Android, so I'm not sure how this stuff really works. I don't even know if we can do it with Android phones, but I know it can, I think it can, so. But yeah, however you can, leave them with resources that they can find out more. There are quite a bit now, quite a bit. Okay, and thank your listener. Let your audience know how much you appreciate them listening to you and having their support. And it does, it really goes a long way when you express appreciation because, people are busy, people have short attention spans, so if someone is actually taking the time to listen to you, then that's a big deal and it should be acknowledged. They don't owe us our time. And practice and refine. Yeah, basically self-explanatory. You practice once you have your elevator pitch ready, practice it, practice it in the mirror, practice it with people. Try to think of different scenarios in which you would have to alter it based on with whom you're speaking or what the situation is. Be open to questions and further discussion. Make sure that your audience knows that questions are welcome. You want to be there so that they understand. Like some people think that asking questions could be intrusive or rude, so they don't want to. But we want to let them know that we're here for that. I'm so sorry, but okay, and remember to wrap it up that the key to an effective elevator pitch is brevity and clarity, brief and clear. You just want to make sure that you're conveying the most important information. Like I said, we're aiming for a short period of time, but we want to make it easy and clear and easier for our family to empathize and support with us. And even if they're not our family members, even if they're not people who we love, that makes it probably even more important to have it down so that it doesn't take long, but it imparts the message. And yes, so we're getting ready to have our session of breakout groups, so I'll call Shirley back in. Oh, yeah, right.
Okay.
I was looking for this card.
Good. You want to say anything else?
Oh.
You have found a card?
Because I couldn't
Okay.
find one of my cards, but I
Oh.
found it afterwards.
Okay, so here's what we're gonna do. First of all, don't ask your questions yet, because we're gonna practice first. So Deb and I are gonna do a role play, and then we're gonna break out into dyads. And if you're here with someone, could you please think about not doing it with the person you came with, but doing it with someone else? Because that's really how it's gonna happen. It's gonna happen in real life with probably someone you don't know. So if you're new to migraine and you've never done this before, you can practice your general pitch to a friend, family member, coworker, boss, anybody that you would, that comes to mind that you want to practice doing. If you're an expert, probably like this table right here, it would be nice if you guys could practice to these rebuttals. Okay, so we're going to leave this up here. Deb and I are going to do a quick role play. I'm going to be her boss. Let's go. We should probably stand right here and do it.
Okay.
Okay, come closer.
Right?
Yeah.
Okay. Hi, Shirley, my nurse manager, supervisor. This is my last day. I'm getting ready to go on medical leave.
Medical leave? Really? But you look fine. What's wrong?
Well, you know that well, maybe you don't, but have noticed that I've been walking around the hospital with sunglasses on, and that's because I have chronic migraine.
Oh, migraine. Well, isn't that just like a really bad headache? Why would you have to go on medical leave for that?
Well, actually, it's a lot more than a really bad headache. To tell you the truth, I've really been struggling because my team and I have been unsuccessful in coming up with strategies. And so besides all the struggling that I've been doing at work, I've also been struggling at home, and I've been unable to function because of my health. I've been a lot of pain, a lot of the side effects are are making it impossible for me to do my work correctly, but it's also making it impossible for me to function at home. So that's why I have to go.
Wow, I had no idea that it was that serious.
It's very serious. I know that it's been said that I'm going out on vacation for the summer since this is June. And as a response to that, I just have to say, I would rather be going out on I would rather keep working and getting paid and not be home in bed feeling terrible, not getting paid, even if it is the summer.
Wow. Well, I wish there was more that we could do for you.
Do you?
Yeah, of course I do.
Okay, well, let's talk about some accommodations.
Really? Like what?
Well, for one, honestly, I could use a screen for my computer, and I could use a dark room. Maybe when the quiet room isn't in use, sometimes if I need to go during my break, I could go in the quiet room instead of having to go to the employee lounge.
I think we could do that.
Okay, I really appreciate that. Be helpful to me. Okay, really quickly, I just have to tell you, that's based on a true story, because when I went on my second medical leave in 2014, and I told my boss, Dave, he just looked at me and he said, going on vacation for the summer, huh? That's exactly what he said to me. At that time, though, I really wasn't an experienced advocate, and I kind of just was like, my doctor told me how, but, I just kind of laughed it off. So it was like, but the even crazier thing about it is that Dave was actually diagnosed with migraine himself. And he had episodic, so he didn't get them often, but he actually had migraine himself. And so I bring that up to say, I know this is a side point, Shirley, I'm sorry for taking more time.
No, it's fine. It's fine.
Bringing back stigma, Dr. Young. Migraine stigma from other migraine sufferers. That's a thing.
Yeah.
That's a thing. So
Why does that happen? Tell everybody, why does migraine stigma come from other people with migraine? Because it's on a spectrum. You've
Exact-
got episodic people over here who are not very debilitated, and then you've got people like some of us who are experiencing symptoms 25, 15, whatever days a month. And so they just take a medication one time a month, or maybe 2 times, because now they don't have to divvy up their medications because, you know, like to the gentleman's question before, we only get to take maybe 3 days a week of medications, and if you run out, well, what are you gonna spend thousands of dollars to get more? Yeah, the new drugs maybe don't cause rebound headache, but, you know, you're only gonna get so many a month. So anyway,
Yeah, so, I mean, don't, like him looking down on me, basically, it was like, I pushed through mine, I still come here, but, you're going on vacation. So, I just say, just to encourage everyone, let's be careful about what we say to each other, and let's also, if we are the target of migraine stigma from other persons with migraine, that we don't internalize that, because they live with their disease, and we live with our disease. So that's all I had to say about that.
thank you. Okay, thank you, Deb. So we're gonna break out into dyads, so maybe you can go to another table. If you're a caregiver here, which I know there are some caregivers here, perhaps you can work with another person that has migraine that's here in the room, and you could work together in any scenario that you guys come up with. So let's break up. We're gonna do this for about the next 15 minutes, and then we're gonna come back and we're gonna share our experiences. I forgot to tell you there are worksheets on your tables, so please get a worksheet on the elevator pitch and use that as an example so you don't feel completely blind at this. So we'll come back and each person gets to take a turn. Don't worry if you can't do it in less than 2 minutes. Take your time. It's your first time. Just do what you can and then switch. Okay, let's wind it up. We've got another 30 seconds, so wind up your elevator pitches, please. Okay, let's come back to the group. Let's come back to our circle, our big giant circle. Thank you everyone for doing this. So I'm just going to go around to each table and ask you what your experience was like. And notice, here's a practice of mindfulness. So notice how you're feeling right now after doing this. Notice, is it positive or negative, or maybe it's neutral? I mean, I used to teach mindfulness, so that's why I'm doing this with you right now. So notice how you're feeling about sharing and disclosing, and if it was hard or easy or whatever came up for you. But also talk about if you had any key takeaways. So I'll start with this table right here. So who wants to talk about your experience? I can come back to you if you're busy eating. Does somebody else at that table want to share? Yeah, please.
I didn't do the pitch, but it was a great pitch, and I asked if you practiced, and you had. But I thought it was really good, and I'm a caretaker for her with her migraines. But I do have chronic back pain, so I think that helped me to identify with
Yeah.
a lot of the things that he was saying. And one of the points I made was, if you're speaking to someone that can identify in some other sort of way, I think it tends to be that they're more receptive versus when we talk about that stigma. I know sometimes with my back pain, I'll worry about like sharing too much and then that's thinking less of me after the fact, after my elevator pitch, so.
Okay, good. Thank you for sharing. Anybody else want to say anything at that table? I think we have time to maybe hear from everyone. Go ahead. What's your name? Just say your name, by the way. Olivia? Okay.
I worked with Anne, and I liked when she was like describing with an explanation. She said, she mentioned like a neurological condition, and then mentioned like the spectrum, because I feel like that helps really explain the seriousness, but also that it can differentiate between people. Like it's not going to be the same symptoms for everyone.
Right, exactly. Good. Thank you. Anybody else want to share at that table? And you don't have to share if you don't want to, but if you...
I found giving the speech, and I've done it, I try to educate everybody and everybody who will listen to it. I found myself feeling anxious,
Okay. Okay. Good. So that's what came up for you, feeling anxious and noticing that. That's good that you noticed that. Okay. You don't have to say anything, but you can.
I was just thinking, like myself personally as a migraine sufferer, you kind of feel inferior.
Yeah.
So, to bring it out to people, you're kind of admitting that there's something wrong with you. And it may impact them if you're going to be together and you have to bail out from that situation. For example, I was saying, like, I was pretending she was a golfer. I was going to go out. And here I am. If I get a migraine attack on the 6th hole, I'm done. So that was part of what we were talking about.
Okay, good. So do you feel like you were able to express
Yeah,
that?
I think
And
yeah, when you do the elevator pitch, then it's not a surprise to anybody.
Okay.
At least you've told them where you stand.
okay.
And you're comfortable in doing what you have.
Yeah, okay. Actually, I should let Deb be doing this. Deb, can you come up here and do this? Why am I doing this? Because I just took over, because I am the firstborn child and I take over for everything. So, go ahead.
Okay, any other comments, questions? Are we doing this table?
I just want to say one more thing.
okay.
When you ladies were speaking earlier about the stigma for
Yes, very true. I noticed that there are a lot of, in the migraine groups, like on Facebook or whatever, somebody might come in there and ask a question. What works for such and such? It always gets to me because it's going to be 100 comments, answers, and they're all going to be different. And some people they take some of that stuff to heart, like, oh, if it's not going to, don't ever try this because it's going to do this to you, or this will work miracle for you. So it's important to continue to understand that this disease is, like I said earlier, it's unique to all of us. So it helps us to also be a lot less judgmental of other migraine, people who live with migraine. So, no one else from that table? Next table? Did you guys anyone want to speak? No? Well, even if you didn't, did you find that it was, any part of it was too challenging, in your opinion? Is that, no? Okay, all right, just want to make sure. Okay.
I was just gonna say, I guess, like just in general, I'm not great at talking to strangers or others in general, so that's the difficult part to get over, but I've actually had good experiences at my current job. I brought it up to a couple coworkers, and they were actually pretty receptive about it, and were offering if they wanted to turn the lights off, or they have a room to lay down. So they actually responded really well, which was surprising to me.
Mm-hmm.
Kind of mentioned before, like I struggle with as well having the stigma against others. So even when I get a migraine and I have to lay down, I do still feel like I'm weak. Like why can't I push through when there's others that have pushed through their headaches or migraines or whatever, and they can work and I can't. So it's like fighting with that, but also definitely helps that they are supportive and they do bring it up.
And that's great. I mean, what you mentioned is self-stigma. So we always want to, fight against that because this is the nature of what you have. So it's not your fault. You didn't choose it, and you're not lazy or weak. I mean, this is what it is. What it is. So I'm glad that you do have some coworkers that are really supportive. That's a blessing for us wherever we are. Okay, thank you. Next table. Sure. Yeah, anything you want to share?
No, I mean, I think it's pretty easy. A lot of times because of the type of migraines I get, I don't know, I get cervicogenic migraines as well as sinus migraines and regular migraines galore. So trying to explain to people what especially cervicogenic migraines are is a little difficult because they don't understand. They're like, oh, you just have a sore neck. Well, no, I don't. It's herniated discs in my neck which cause pain and pressure, the tightness, and it just flips over my head. And a lot of people don't understand that it's just not just, okay, I have a sore neck, it's sore.
So it's more challenging for you because you have a combination, of different diagnoses related to your migraine. So you're saying it'd be more challenging to fit that into an elevator pitch?
It is because you have a little bit more to explain to people.
Mm-hmm.
Because, okay, cervicogenic is, okay, I have 4 herniated discs in my neck. There's nothing really, I can't, unless I go through surgery, which I don't need right now, thank God, hasn't gone that far. But it's something that I deal with and I live with. It's just wearing my body down from playing sports for so long.
Do you feel that, were you able to come up with an elevator pitch?
Yeah, for the most part.
Okay, great. That's great.
I mean, it's one of those, it's not a 2-minute thing, it's a little bit longer just to explain, because everybody, if you say, oh, you get a migraine coming out of your head, they're like, okay, well, you just have a sore neck. No, it's a condition that I have. That's how.
Yeah, I mean, it's a little more complicated for you. I just think, it will take just some more practice. I mean, to go into, I would say, probably a good strategy for that would just to be straight up, I do have migraine, and, this certain type of migraine that I have, cervical, how do you pronounce it? Yeah, that. The way that it affects me is this, you know, and go on from there. And that way you don't have to break down each certain area, you know, each diagnosis that you have. It'll save you some time and it'll get to the nitty gritty and the more debilitating part of what you have, so.
And a lot of like all my stress is up here, so it means it's fun.
I got you. PT, acupuncture, massage, I have all of that, plus my husband, my heating pad. Yeah, I live with that as well, so I understand. I understand. Yeah. Anyone else from the table want to speak? No? All right, thank you. Next table, you want to speak? Sure.
I thought it was really helpful, having Dale kind of do his elevator pitch. As a caregiver, he's doing kind of a pretend pitch, because I sort of took being someone who lives with migraine, took the kind of ignorance role of like, well, really what you're saying is you just have a headache. Like,
Mm-hmm.
take some things that are migraine and like you're good, right? So it was a little bit cathartic to give back what is often thrown at, you know, over the years.
Mm-hmm.
He explained it really, really well in a very concise way of just like, look, it's a really complex neurological disorder, and, you know, but not in a defensive way. He kept it just like a very straightforward, here's the symptoms, here's what it is, and I just love that. Because I think it's easy to also feel very defensive of yourself when you live with these things, like you have to kind of fight back, and Dale just kept it like very matter of fact, look, this is
Mm-hmm.
what it is, like, and not like, no, you're wrong, but just no, look, it was just, let me share some information with you, and I thought you did a great job.
Yeah, I would definitely advise anyone, don't hesitate to ask people to practice with you. Even someone who's not, you know, who you don't feel is an expert or whatever. Of course, if you find somebody that's an expert, that's great, but just practice with each other. That makes a big difference in helping to refine what you say, because sometimes you can have the thought but not exactly know how to phrase it effectively or have it come out the way that you like, so bouncing it off to someone can sometimes make a big difference. So that's really great that you were able to do that. Did you have a comment, Dale?
There seems to be somewhat of a difficulty when you're talking to people about migraine, that they don't quite, if they have minor migraine symptoms and can take the, you know, Excedrin migraine and it goes away, I don't know that they completely understand how debilitating, you know, chronic migraines are. And so there's it's just difficult. I think it's difficult in an elevator conversation to convey to them exactly how difficult this is to deal with.
Yeah, I agree. That's why, as we're practicing, we're making sure that we insert how we personally are affected. Because we can state generally what the symptoms of migraine are, but when we actually state the impact that it personally has on our lives and the effects that it has, that's in their face. And that's something that they can't, like, a lot of times it just opens their eyes. Says some things to people are so normal, they don't think. Like, they don't think that, to understand that, you know, when you go food shopping, that it's so hard for you to finish the grocery shopping that you can't even bring the groceries in the house. So you leave some of them in the car, the ones that aren't gonna spoil, and you just bring the ones in that you have until one of your kids gets home from school so they can take the rest of the groceries out of the car. Then you still gotta put them away. And then people are like, what? Like, they never even heard of that because it's just not their reality. But when we tell our story, it opens their eyes. They're like, oh, shoot, wow. So just a simple little story like that, it can give, you know, a lot more insight into what's going on in your life. And that way you don't have to get into a whole lot of details. Like, you know, like I said about earlier, mopping the floor wears me out. Other people mopping the floor is just mopping the floor. All right, let me go on to the next thing. For me, I'm sitting down. So you know. I'm sorry, first of all, how much more time do we have? Okay, okay, okay.
And maybe we can leave them like wanting to research a little more.
Mm.
Like with the little bit that we gave them, they might leave our conversation saying, huh, when I get home, I'm gonna research migraine a little bit. Like Deb's story like really left something in my mind, like I didn't realize migraine was so debilitating. I don't know. So,
Yeah, for sure,
yeah,
yeah.
because we only have so much time with them.
Mm-hmm, yeah. Did anyone else at this table want to share? No? Yes?
Well, this all started with that, an accident, a fall, and then I hurt my back, got stimulators and stuff like that. And because of that, I kind of lost a lot of friends, because they called me up and asked me if I wanted to do something. Say today's a bad day, I'm in a lot of pain, and it's like, I just don't want to hear it anymore. And then when I started getting migraines, it's the same thing, like I work for Phillies now, and I'd say, you know, I start to work even with a migraine because nobody wants to hear it. That's my problem all the time.
Actually, I meant to bring that up when I spoke earlier, but probably was on the card that I lost. But I wanted to say that a good time when we're talking to the people in our lives about what we need, I also like to add in there, please don't assume anything about what I can or cannot do. Please do not invite me to things. Make sure, please continue to ask me. Please continue to invite me. If I can't do it, I'll let you know. Please don't call me. Please don't not call me because you think my head might be hurting. If my head hurts like that much, I'm not answering the phone. Like, I think when you clearly say that to people and let them know, it helps. Because like I said earlier, some people do think there are some selfish people out there who don't want to be bothered, but a lot of times there are people who just think, oh, I don't want to bother her, I don't want to, she's not feeling well, I don't want to put pressure on her, stuff like that, when in the meantime, we're sitting in there by ourselves getting lonelier and more isolated than ever. So I think that's an occasion where we can try to be clear, even if it's progressed to a certain point where it's gone too far. I think it's still not too late to go back if these are actually people that actually care about you, to go and clarify some things. Yes.
Can I just add, I think on that same point, it's something that I've done at work because I think I've worn that mask for so long because I feared that I would be seen as not capable.
Mm-hmm.
And then when I finally did speak up, I said that very thing was like, please don't assume that I can't take on a new project or don't, it's not a good time. Always ask. Like, I like that right of refusal or that opportunity to say that I'm not in a good place right now, to take the extra thing or to have an opportunity. Because ultimately then people just stop asking and then that's how you slip back down, go to that ladder. And so far it's worked well, but that's a huge fear. I think it's a real fear that when you finally speak up and try to advocate for yourself, that like you end up shooting yourself in the foot. So you have to just be very clear on what you want from that and remind people because
Mm-hmm.
I think they're doing it out of kindness,
Mm-hmm.
but it can also, you start to make up stories in your mind as to why you don't hear from people.
Exactly. Yeah.
I totally agree with that. I actually had to say to someone, please don't make decisions for me.
Wow.
Like, just like you were saying, if you don't want to, if you don't think I can come or you're going, let me make the decision that I'm not able to make it that day.
Yes.
At least call me.
Exactly. Did you want to? Oh, she said if only I'd learned that lesson earlier. Doesn't matter. I mean, we just can, only thing we can do is go forward. I know it, it's hurtful to lose people in your lives and then, because it kind of makes you question, well, what did you really think of me all this time? I thought we were friends. I thought this, that, you know, I wouldn't just abandon you, you know, and everything can't be solved with communication, but I think on both sides, because of the things that we deal with internally and the perception of migraine out here in the world, a lot of times I believe that we do tend to keep more things to ourselves and not say things. And then we don't say things, and then they assume things, and then act accordingly. And then in the meantime, they're going off, and now we're left here like, what the heck happened? Why did I lose this friendship? Why is my family not, you know, including me in the things that it was no question that I would, you know, be included in before? And it can be very, very hurtful. So the only thing we can do is move on and help those that come with our advocacy. So thank you. Anybody else from this table want to share? Any comments? Tom?
Thank you for putting this together, Charlotte. Thank you, Catherine, over here for the presentation. This beautiful room from 1909. It's this wood with this lighter columns.
He's the most appreciative man on earth, and he is 100% genuine for anybody that doesn't know him, okay? We love Tom. Well, go ahead.
To get to the point, Danielle and I work together, and we really have a relation, we agree on something. We really don't like to talk about it.
here in the back of the room?
A little louder. Danielle and I work together, and we happen to be neighbors, it turns out. I met her in a Rite Aid a couple years ago. She had a cluster bus backpack.
Oh, wow.
She lives
Cluster Busman is a nonprofit for people living with cluster headache disease.
So anyway, we both agree when we're doing our elevator pitch at the table here that we don't really like to talk about our pain or migraine because we just don't really like to talk about it unless it really hurts. And Danielle found out that I've been working at the same job for 50 years and none of my employers know about this because they didn't ask. It's none of their business. And people work around with a flexible work schedule, working from home and working flexible hours. And it dated them for 50 years, but I told Danielle that there's two young women I work with that I'm mentor to that I've entrusted them with my secret because they both get migraines. So I thought since we were working together on mentorship, they mentioned their migraine disease. I said, you know, I've been getting this for many, many years, and there's light at the end of the tunnel. You can learn to modify your life to live with it because there's really no alternative. You have to. It's delicate balance. You can modify your life, and you know, I appreciate working with you, Danielle, because I realized when you told me your story that it's difficult to deal with, and it's difficult in your personal life, employment life, and like we said this morning with the doctor, it affects so many other things besides your head. Your interpersonal relationships. Whether you can go to somebody's birthday party or whatever, and say, look, I'm sorry, I'm under the covers right now, I can't go. You know, and they don't understand. The reason I can't go, I don't listen to you. So I appreciate working with everybody at this table today. Thank you.
Thank you, Tom. Anyone else on the table? No? Okay. Final table?
Actually, it's funny, because you know, I've been friends with Terry, this is Terry, I'm gone. I've been friends with Terry since 2017, and I just found out today she gets Oros. I was like, holy crap. That was just a thing. But I realized I feel, it's based on the situation. I don't have like a specific elevator pitch. But whatever situation I'm in, I was going to be talking to somebody, I tell them that, you know, just about everything here.
Mm-hmm.
So it's just based on the situation that I do. I don't have anything I'm on.
Okay. Did you have a thought about that too? Since you guys were both going back and forth, because I was sitting there.
I mean, I have two headache disorders.
Mm-hmm.
So one or the other or both. So
Mm-hmm. Okay. I know you said you had written elevator pitches before at Headache on the Hill, for Headache on the Hill?
Yeah, I have one written.
Okay.
How long ago what Headache on the Hill was, Dad? Please?
Another description, huh? Okay, Headache on the Hill is, and please jump in where I'm lacking. When people in the headache community go to Congress once a year to, I hate that word. But yeah, I guess lobby for better legislation to benefit those of us with migraine and other headache diseases. Remember what we stated earlier about the fact that migraine does not receive anywhere near the amount of funding for research. And so now we go, well, it's been virtual for the past few years, but it'll be back in person this next coming year. We go in person and speak to them face to face. We present an elevator pitch. And am I missing anything?
There are like probably what, I think like 40 or 44 states that we get that come.
And it's 2 people from each state, right?
Senators, your own representatives,
Two people.
you know, you give your address and your work address, and those are the people that you go to.
Yeah.
Unless you're like a small student.
So yeah, if anybody is interested in that, you can apply for that, but I'm not sure which website you apply for that in. Alliance for Headache Disorders Advocacy. You can apply for that. They're actually taking applications right now for this coming Headache on the Hill, which is normally in February, correct? March. March 18th and 19th. Yeah, so. Oh, it's virtual and in person this year?
The virtual is not until September.
Oh, okay.
Yes.
I noticed you talk about a lot of things that you should do in an elevator pitch. Is there anything you should not do in an elevator pitch?
Take too long, get into a lot of detail, because that's going to make you take too long, and also it can impede what they keep, because so that's why you want to, that's why we stress clarity and brevity. I mean, I'm not sure, besides getting too technical about migraine, that also, like, you just want to, basically, whatever, when you're writing your elevator pitch, just think, what would keep my attention? You know, what would make me start, you know, getting glazed eyes? You know, you don't want to do that. So, yeah, pretty much that. So, we are out of time. Thank you, everybody, for your questions.
As always. Okay, we're going to our last session. Yay. You guys are learning so much. I don't know how to do this. How do I get out of here? I only have a Mac. Nice AV man from the back coming to help me. Okay, so before we get started on the last segment, we're going to do a quick little stretch. Okay, so either stand up or you can sit down if you're too tired to stand up. That's okay. Let's just do a deep breath in and raise our arms up. Inhale and exhale, release. And one more time, inhaling all together. And exhale, release. And one last time, inhaling, rising up with the arms. And exhale, coming down. And then noticing in your body what needs any adjustments right now. Maybe it's rolling your neck, because I know my neck is really tight. Or maybe it's doing shoulder rolls. Or maybe it's bringing your arm across your body. So just do whatever feels good for you right now. We're just going to do that for 30 seconds. Or maybe it's just sitting quietly. Okay, when you're ready, coming back to your chair and noticing we're almost at the end of the day. And this is going to be the most important part of the day, is doing the post-survey. So if you can hang in there for another session, that would be fantastic. We really appreciate it. So this session is about talking to your doctor. Has anyone here not gone to a doctor and had a conversation about headaches? Anyone not ever gone to a doctor? I mean, to talk about headaches. Everyone here has talked to their doctor. Does anybody see a primary care doctor only? Does anyone go to a neurologist? Okay, does anyone go to a headache specialist? Both, maybe. Does anyone go to a PA or NP, if you know what that is? Okay, so everyone goes to a doctor. Okay. Nurse practitioner, yes, I know you do, that's right, okay. So a migraine, again, is a neurologic condition that can be challenging to manage, as we've all learned here today. And, you know, one of the things that prevents us from talking to our doctors is stigma, because doctors can also stigmatize patients, and that may have happened to you. Has that ever happened to you? Maybe you're not even aware of it. But if your doctor doesn't have adequate knowledge about migraine, it's essential for you to communicate effectively to your doctor and make sure you get the appropriate care. So why do doctors stigmatize patients? Well, first of all, they don't get a lot of training in medical school. There is maybe 1 hour on headache. I always ask doctors this question because I talk to a lot of doctors. How much training did you get? Oh, I don't even remember talking about headache and migraine. Gosh, or I got an hour. And one of the problems is that, especially if you go to general neurology, not trying to knock them, you might have a great general neurologist, but a lot of those doctors don't like to treat us because we don't get better and we are hard to treat. And we are drug seekers, mostly for opioids, which is not true for probably everyone in this room. So when you are talking to your doctor, one of the first key points is to prepare in advance. And so you do have a sheet on the table, in the middle of the table, that we're going to use. We're also going to do a breakout session. We're going to do a talking to your doctor session, because there may be things that you haven't talked with your doctor yet. If you don't think you're getting adequate care, there are things that you may have not said to your doctor yet, and that's why we're doing this today. So what you want to do first is you want to talk about all of your symptoms, triggers, again, not so much about triggers, but talk about that bucket. Talk about, you know, the bucket theory that we talked about earlier, like what fills up your bucket until you get to the point of having a migraine attack. And then make sure that you talk about your history. This is so important. I hear doctors say this all the time. Patients come into me and I've asked them what they've tried, and either they can't remember or, you know, they don't remember. So make sure that you do a migraine history before your appointment. Go to the pharmacy, go to your prior doctor. Very important. You don't want to keep trying the same preventives and abortives. Yes?
About the triggers where it says optional because they might not be evidence.
Yeah, so triggers are not always evidence-based. So for example, chocolate. I wanted to stop Dr. Sivak because she probably didn't mean to say it like this, but chocolate is not necessarily a trigger. There is not enough research done to show that chocolate's a trigger, where in fact what chocolate is really doing is before a migraine attack comes, the brain starts to crave sugar. And that's how some of us know that the attack is coming. And when that happens, what's the first thing you reach for? Chocolate, because everyone loves chocolate. And so that's actually what we call a premonitory symptom before the attack is coming. So you could say, I'm eating chocolate and I'm getting a migraine every time, migraine attack. Well, the doctor would say, well, don't eat any more chocolate. Now you know that chocolate is not triggering the migraine. It is simply bringing you the awareness that the brain is asking for something sweet. And there's lots of other things out there. People will say cheese, you know, triggers attacks. Well, there's not enough evidence based on that. And if you're someone living with chronic migraine, just live your life. You have so much anxiety coming at you all the time because you never know when the next attack is coming. It may not be food. It may be that the attack was coming anyway because the bucket got filled up with all those other things that cause us stress and anxiety. So note down your questions and concerns. To talk to the doctor. Be clear about your symptoms. Don't just go in and say, I have really bad headaches. What should I do? Well, that's just not enough information. So you want to talk about the frequency. How, you know, you want to chart this for yourself. Take one piece of paper, put it next to where you brush your teeth every night, And just put a check mark if you had a headache that day. That's all you have to do. Do not go into detail because it might just bring you too much stress. You can do it that way, but there's plenty of good apps you can use. But try to notate the frequency, how long the attack lasts, and what the pain intensity was. Usually doctors will use a scale from 1 to 10, 0 to 10. Talk about your other symptoms. Do you have aura? This is really important. If you haven't told your doctor that you have aura, or your doctor hasn't asked you, then that's different. Migraine aura occurs in about 20% of people with migraine, so you need to talk about that. Talk about sensitivity to light, sound. Explain if you're having dizziness. If that's a new symptom for you, you need to share that with your doctor. And don't just say like, well, I've got migraine and I throw up and then I feel better. You need to say to your doctor, I'm so debilitated by migraine that I'm missing work now 5 days a month and my boss is about to fire me, or I'm about to get divorced from my spouse because they don't understand. So key point number 3 is document your migraine triggers. So that is, again, totally optional. I just put it in here because everyone talks about it. For some people, they find it helpful. I personally don't find it helpful, but we're all different. But explain how you have identified these triggers. For example, if light is a trigger, and right now this light is shining in my eyes, that's why I've got these green lights on. If I didn't, I would probably walk out of here with even a worse headache than I have now. But I know it's a trigger, so explain that to your doctor. I have lights in my office and where I work, and they're fluorescent lights, and honestly, I end up in the bathroom every day and having to go to a dark room because of that. Talk about your medication history. I just talked about this, very important. Every single thing that goes in your mouth and your body, you need to tell your doctor. They may not be familiar with some of the other supplements and that kind of thing, but that's okay. It goes into your medical chart, and if you ever end up going to another physician, then they have all that documentation. And talk about what you have been on, because if you tried a preventive, say Topamax, 15 years ago, maybe you don't want to take that again, because that sometimes comes with really bad side effects, such as memory loss, which a lot of us already have from having brain fog. You want to talk about that too. Talk about your goals. So this is important, and I never really thought goals were important until I talked to a couple of doctors and they explained to me why it's important to them. Let's just say one of your goals is going to the gym. Well, if that's your goal, then your doctor might think to themselves, oh, you know what, so I'm going to give Shirley a pre-treatment. I'm going to say to her, every time you want to go to the gym now, I'm going to recommend you pre-treat with XYZ. But if I were to say to my doctor, my goal is I want to go to a concert where there's a lot of loud sounds and light, then the treatment might be a little bit different, because now we have devices that can prevent lots of sound. And we have these, type of glasses you can wear for light. So it's going to depend on, you can't just say, I want to get better. I want to be 100% better. We all want to be better. But the reason that you're all sitting in this room right now is because we don't have enough research. I can't stress it enough. We need more research, and we need more funding from the NIH. And the only way we're going to get it is for you to go all tell your elevator pitches. And I guarantee, in our lifetime, if everybody did that, all 42 million of us in this country that are affected by migraine, we would get a lot more money from the government to research. Okay, so ask questions. You might want to write that down in advance. So on that sheet, you'll see at the bottom, you can write in your answers before you leave here today. And you can practice that before when we do the elevator pitch, if something comes into your mind, like, oh, I forgot to tell my doctor that, every time X happens, I start vomiting because, for whatever reason. I mean, some people have nausea and some people don't, so it's important to share that. Don't hesitate to ask about the latest migraine treatment, because these guys that were here today had that information here, right? But if you walk into your doctor and say, oh, I just saw Lady Gaga on TV, and now she's back in her piano, and she's playing her music. I want to be like that. Well, you know, here's the problem with that. If you go in and your doctor just started you on, say, you know, what are the CGRP? That's the class of medicine, that's the newer class of medicine that a lot of us are getting therapy now for. If you haven't been on that medicine, maybe for 6 months to a year, it might take that long. It takes that long for some people. And because every migraine patient is different, we are N of 1. You've seen one migraine person, you've only seen one, because every single one of us in this room will respond differently to medications and other therapies. And that's really important to know. The new research, Dr. Young talked about it this morning, is that they are now finding that the longer you stay on these therapies, the better chance you might have of them working. That's very important. And what we're finding is that a lot of patients are going to their doctors and asked to be switched. Oh, it didn't work. I tried it for a month. It didn't work. It might take time, okay? So I know that's really hard to be patient when you're a patient, but I can't stress that enough. Yeah, especially when you're in pain. If you are not getting the care that you need, ask to go see a headache specialist. You're all going to neurologists, great, but if you're still not doing as well as you would like, you need to see a headache specialist, and it takes a long time to get in. Why does it take a long time to get in? Anybody know why? Not this table. There's so few of them. Why are there so few of them? Yes, because doctors are stigmatized too. Do you know that if you talk to any headache specialist and say, why did you go into headache medicine? Well, you know, I almost didn't go into headache medicine because my department head told me, why do you want to treat those patients? They never get better. And you're just going to be hearing complaining and whining for your whole career. Well, guess what? That's not true. A lot of us do get better. We don't get cured because there is no cure, but we get better. And so that's why you have to wait so long. Okay. Yes, collaboration on a treatment plan is very important. If you're someone, for example, that, like me, who travels a lot, you might, you know, and they say to you, well, I can give you this medicine, you only have to take it every 3 months. And you'd be like, really? Okay, I try that, because then I don't have to like be back in my hometown waiting, you know, for the next, for my prescription to get refilled, because I might be out of town that time. I mean, that's just a poor example, but I can't think of another one right now. But make sure that whatever you are trying is something that's going to work into your lifestyle. It may not be easy. You might have to, you know, give in a little. That's just the way it is. But, oh gosh, no, I lost my train of thought. Okay, it's not important. You know, being patient and persistent. So I heard someone say here, oh, it was Deb. I was like new to advocacy and I didn't want to tell my boss that no, I wasn't going on summer vacation. I have freaking migraine disease and I can barely function. Well, you're gonna have to really be patient when you are trying therapies. Like I said, they take time. You might have to go and try 10 therapies until you find one that works. That's just the reality of the way things work. And again, I'm a huge proponent of advocacy. It's really important that you speak up, be assertive but respectful, because doctors don't like when we come in and we say, well, I read on Google, blah, 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 that if you put your feet in hot water, that this is a true thing on TikTok. Their doctor posted that if you put your feet in hot water, you'll get better. Well, that doesn't work. So that's a bunch of BS. But you want to also, you know, just make sure that you're getting all the information out there that you want your doctor to know. I know a lot of this seems really obvious, but here's the thing, you guys. It's using our voices that is really hard. You see how hard it was for your elevator pitch? Sometimes it's hard to be concise in the doctor's office because you have so many symptoms and it's doing this and it's doing that, But you have to go through a whole checklist of things and make sure that you get everything incorporated into your encounter, because sometimes you only get 15 minutes. So it's not a lot of time. That one's pretty self-explanatory. Okay, here's what we're gonna do. We're gonna do the same thing that we did before, and we are going to, you're gonna craft your story, and you're going to include the tips that are on that sheet. If you wanna write it down, you can. You can write it down later, but hopefully you're in the moment right now and you feel like doing this. So let's do that. Let's do this, and do it with a partner. Let's see, so let's do that for the next, till 1:45. One person can be the doctor, one can be the patient, and you can go through your pitch to your physician and write it down as you're going through it in the interest of saving time. Does that make sense? Does anybody have any questions? Okay, go for it. And then we'll come back and we'll see how it went. Okay, how we all doing? How are we all doing? We're going to see if we can finish a little early, because I think everybody is chattering about other things now, which is fine. Okay, so we're going to do the same thing that we did before. I'm going to go around to every table, and it sounds like a lot of you have already feel pretty secure in talking to your physician, so maybe this was not relevant to some of you, and that's okay. You can just say that. I'm going to start over here at this first table again. And do you guys have anything you can share with us about any learnings? And if you didn't learn anything, then just say, oh, I'm already doing everything right. You wasted my time, Shirley Kessel.
Comments, just as a non-migraine sufferer.
Yeah.
The advocate for this and other things as well. I think like when we were talking about the elevator speeches and the pitch, I think it's important to make sure that you go prepared to every physician or provider's appointment with like a mini, I don't want to call it a pitch, but kind of like a recap of the last time you've been there. So don't just do that when it's a new provider, but making sure that you're pointing out anything that's changed since then.
Good point.
And also don't just, this is general, not just to neurology or migraines, but don't just think, oh, I'm only going to tell my headache specialist about things that I think are related to headaches or neurology. I think it's important to mention other potential symptoms as well, because they could relate, and maybe there's no research out there that they would do now, but you just don't know. And even with treatments, it might be something that if you have high blood pressure, let's say, right? And then you're also looking at trying new migraine medications. They'll say, oh, well, this might help your blood pressure and your migraines.
Right, so there's a lot of comorbidities to migraine. You bring up a good point. And what happens is a lot of people go to their primary care doctor and do the opposite. They go in complaining of symptoms. It turns out they have high blood pressure, or they have diabetes, or they have anxiety and depression, and they never talk about their headaches. So has anybody ever done that and ended up getting diagnosed way after? Well, anyway, the opposite's true. What you're saying is that if you just talk about your symptoms of migraine, it's important to also talk about every symptom, because you could have something else going on. So yeah, good, very good point. And what?
They could identify a medication that could help you in more than one.
Or send you, well, to send you to someone else, hopefully, and not, yeah. Okay, good, thank you. Anyone else at that table?
I just want to say, I love the goals, because it's something I don't do,
Right.
or haven't been doing, so that's.
Okay, good. Yeah, if you don't say what your goals are, like I was saying before, like I want to go to the gym more, I'll just use that as an example, because most people don't work out that have migraine because we can't for multiple reasons, but maybe you can go once a week. And it's a place to start, because there's good research, right, that shows that a little bit of exercise is good for reducing symptoms. Okay, good. All right, next table. Anybody want to say anything back there? I can come back to you if you want to think about it. Yes, go ahead. Oh, you went like this, okay. Yes, doesn't that feel good? Oh, yeah. Okay, how about back here, anybody?
Well, I'll share anecdotally that I am a huge advocate for like write the list, because the last time I went, I actually had an event while I was there, and the doctor looked at the list and saw something that I had forgotten to talk about, but she was like, oh yeah, that's important, and then we talked about that. So
Okay.
right now, that's my
Yes.
what I learned is always
Okay.
with it. And the goals, I think have been very, for me, I was saying that one of the most freeing things was when I said that life is too short for me to never, ever, like to always be on the watch for all the things that might potentially like be the reason that I got the migraine event. So knowing that I'm not looking to, I know it's not gonna go away,
Okay,
And that was very helpful for me.
good. All right, good. Thank you for sharing that. Okay, we'll go to this table. Anybody? Go ahead.
I think for me, I never thought about discussing goals, but I have found in general, like, because I've had migraine for so many years, and I am very guilty of not remembering half the medications I've tried over the years, that within probably the last year or so, I've tried, not only have I tried to recreate the list, but I now keep a tight list on my computer, and I now keep it updated. So whether I'm going for a migraine appointment or to any doctor, I print the list because I just can't remember the history. I can't even remember what I take right now today. So I'll just here, and doctors appreciate that. Like, then I'm not remembering dosages, names, whatever. They don't know what half of them are anyway. So here's my list. So I find that helpful.
Good.
The question I have is, when you sort of either share symptoms or ask about something that's going on and you feel, even by a headache specialist, but feel like it's not taken seriously or sort of dismissed, like what
Ooh, good one. That's a good one, and that's really important. And so it needs to be reframed rather than attack the person and say, I don't feel like you're taking me seriously, because, you know, you could say that actually. I mean, I'm not saying you shouldn't, but it would be perhaps more likely that the person will listen to you if you say, you know, I expressed this before where I was talking about, I don't know, having a lot of this symptom or that symptom, and I really don't feel like it's at a place where I want it to be. Can we talk about this again? I want to share with you more information, and just try to keep it open, questioned, you know, I want to share this information with you. And just jump right in. And then if you continue to feel that way, then guess what? It might be time to find a new provider. I mean, if it happens again, I mean, I can see if it happens once, but it shouldn't happen again. So I hate to say that, but yeah, back there.
I have found it helpful if I can articulate how it impacts my life.
Yes,
It's like, this is the thing that keeps me from driving,
yeah,
right? Or this is, you know, I find this is the one that is, this is what has the biggest knock-on effect for socializing or for whatever it is. And that is, that then, sometimes I'm not using words that are what the doctors, like I'm not describing well what I'm experiencing in terms that the doctor puts a name to. Anyway, that's what I found helpful.
yeah, I think that's so important. It's always important to say how it's impacting your life, not like, I have this symptom, and I want it to go away. Like, okay, well, what's it doing? Like, that's such a good point. Yes, Kelly?
I think to a point, it's important for us to I shouldn't say us, me, to verbalize the quality of my life. Not my number is this on the pain scale, or however you evaluate it. This is how it's impacting my life. This is my quality of life.
Right.
I'm on the couch, or I'm in bed, and that then opens the conversation.
Yeah, because if you're only having, I shouldn't say only having, if you are having 1 or 2 attacks a month, let's just say, and you have to miss work 1 day every month, you're going to get fired, most likely. I mean, you know, maybe not, depending on what you do, but it's really important to tell your doctor, this 1 attack per month, this is how it's impacting my life. So, good point. Okay, anybody else over here? Yes?
My doctor, it seemed like she took me more seriously once I was having migraine attacks on the appointment day. Because we go down to see her, once every so many months, and we do a blind day, and we talk, and we can all be smiling and happy. And she was kind of, okay with the migraines. And then the last 2 times we saw her, my head was exploding, and it looked terrible. And I think maybe that clicked a little. She was like, oh my goodness, let's
Mm-hmm. Oh, that's good. Yeah, Dr. So-and-so, you know what, coming down here today, like, I almost didn't make it. And I just, you know, it's so hard for me to get in the car because the motion and the lights, I can't drive ever. I have to have someone drive me. You know, those are all affecting your quality of life. So, okay, thank you for sharing that. All right, anybody, yes?
I have two things. As far as like the medication list goes, I keep an Excel spreadsheet and I've been doing that for 29 years. And I bring it to all my doctor appointments. Now they've got everything on electronic, so they don't, but I put it in pen paper. Also, if you're out like one day a month or whatever, apply for FMLA. That'll cover you. And you won't get fired. Even if you leave early, those hours just count towards FMLA.
Right, yeah, depending on your job.
Yeah.
Right, like, if you work at Miles for Migraine, we don't have FMLA, but you can take off as much time as you want. You know, we don't, anyway, I'm joking, but you're right, that's a good point.
To comment on that, I work in HR and healthcare HR.
Hmm,
And I'm not on the benefits administration side, but I will say it's always better to not wait until you need it, right? Because FMLA paperwork, there's a lot to that. You can't just be like, here, doctor, you fill this out and then get it back the next day. And that's one of the things that her headache specialist said that, you know, when she graduates from college, before she starts her full-time job, to make sure that she's going in, you know, 6 months ahead of time to her specialist to say, here's the paperwork, and not wait until she needs it. Make sure that that's already on file, and hopefully she won't have to use it, but if she does, you have that resource available to you.
yeah,
And that's a federal protection of your job, so it's not something that like, oh, does my department offer it or not. You have to be with them for a certain time frame and such, but
yeah,
use it. It's a federal job protection. It's there for you.
good. Well, if you work for HR, can we talk to you about getting a team for our race next year here in Philadelphia? Because we need to talk to HR managers, and migraine affects so many people in the workplace. Some of them are here today. And so, you know, that's one thing that's missing from the workplace, but that's a whole nother topic.
I'm in Delaware, but yes, I'm happy about
Okay.
what you're talking about, so yes.
Okay, okay, good.
And I'm not on the benefits side, but yeah.
And what?
I'm not on the benefits administration side, but
Okay.
I can definitely, you know, help and so.
Because, wow, it's such an unmet need in our community about people in the workplace, and some of the other nonprofits are trying to work on it, and it's been really hard.
And
So,
it's not safe to ask or you don't feel safe
right,
asking your employer.
yes,
You don't want that stigma
exactly,
coming back.
yes. All right, any last questions or comments about the day? We're going to wrap it up. In just a minute, I'm going to call up Anastasia, who's going to talk to us about the research project we're doing that you'll just need to stay for just a few more minutes and complete. Any last questions, comments? Yes, Deborah.
No, I just wanted to mention, everyone is not in a position to do so, but if you are not getting satisfaction from your provider, don't be afraid to fire them. That's right. I'm personally an example of someone who stayed with a provider for too long. And, something, you know, something was telling me, maybe you should move on, you should move on. But I did it out of fear, I
Thanks, Deb. Okay, Anastasia, you want to come up here?
So on your table is either a QR code for the post-participation survey. So we had the pre-participation survey, and now we should take the post-participation survey. If you don't want to do it on your phone or whatever, there's cheaper surveys there as well. And if you do want to do it on your phone, I found out that the password for Wi-Fi here is, the user is CHC Guest, and it's spring with a capital S 2022. So if you weren't able to log on, that might make it easier. So I'm going to give you a head start. When I created the survey, SurveyMonkey said it takes 11 minutes to take this one. I don't know how long it takes you, but if you would, it means a lot to me. So these pre-participation and post-participation surveys are important because they kind of say where you started from before this event and what did you learn during this event. So they have a series of goals. Did Miles for Migraine accomplish their goals? So I have been working with Shirley to do these evaluations on the last couple of years of these, I guess before the pandemic, and now again back to it now. Yay, it's on! You did it.
It is working, but it's
Well, that's my. Oh, it's blinking.
bad occasionally. So it's very random. I can always do it from back there if you don't want the spasm.
Yeah, why don't you do that?
And
Because
just-
I think
and
that
just give me
spasm
like a-
might disturb
yeah.
people's. But it's the whole. Oh no, it's that. No, it's not.
Yeah. I think it's just kind of being confused with it. Well, just tell me next slide and I'll change it for you.
Fabulous.
Yeah.
I appreciate that.
Of course.
Thank you very much.
Just turn that off.
We will work together, baby.
All right.
Don't trip.
I almost did. Not the first time.
So I'll just give you a couple of minutes to head start on that. Maybe while you're doing that, we want to get you registered for the raffle. So there's that fabulous green light that that Shirley has made available for the raffle. And I had everybody's phone number on there because I thought I was going to do this afterwards, but she made this available today, so let's do it now. Rather than use your 4-digit number, what we're going to do is, you've got the yellow paper, take off a piece, but, make it better than I did, and write your name on it, and fold it, let's say, fold it in half, and then fold it in half again, so they all look alike. And thank you very much, I appreciate it. So everybody just enter your name. No, we don't need your phone number, just your name, because we're going to do it right here, right now.
Take your time filling out the survey. We're not going to do the raffle till everyone's finished.
thinking maybe, yeah, I was gonna give you everything that's not used for you to take and reuse. How many people are still working on the survey?
I'm finished, but I have it here.
Yeah. While folks are finishing up the survey, would it be just drop in if I go ahead and draw the grapple? Okay, well, I'll wait till you do that. I don't know, I feel like it's okay.
thank you for taking the pre-participation survey and the post-participation survey. Those are designed to ascertain where you start from before this event and what you learned during this event. And right now I'm going to talk to you about this mobile ethnography, which is sort of a third phase of this research, which is to learn what do you do with what you learned here during this migraine event. Thank you. And so everybody has on, oh sorry, yeah, the microphone might help. First of all, this is being recorded, so shout out to the people in Phoenix and DC who are doing their migraine event, Migraine Education Day, and also people who are participating virtually. So thank you, and I hope everybody can hear me okay. I think so. So as I was saying, this mobile ethnography, the intent behind it is to learn how you put into practice the things that you learned today. When you go out in the real world, what happens? So let's go to the next slide there, Greg, please. Pre and post participation questionnaires, I just explained that. You can go on to the next slide. So this is going to assess whether what you learned is meaningful in the different contexts of your life and how you put these things into practice. This is social research. It is not involving any kinds of medical interventions, therapies, or diagnostic tools. It relies on the participation of those of you who are here today who've taken part in this education event. Next slide. So real briefly, I'm just going to go over the who, what, when, and where, and why. So let's go to the next slide, which is the what. So using a HIPAA-certified app, you will engage with me in one-on-one private conversations about your experiences with migraine. You'll use photographs, videos, notes to describe what it's like, when you use these different tools that you've learned today, how to self-advocate, how to do elevator pitch, mindfulness, how do you put these things into practice? And so basically, if you can use Instagram or if you can use Facebook, you can use this app. It's very simple to use. And just to reiterate, it's not like you have likes and followers and such. It's private. It's one-on-one. So nobody else in the study sees what you write. It's just between me and you. Next slide. So why? Let me just go over this again. Miles for Migraine wants to know if what they're teaching is helping you, especially during your visits with your healthcare provider. And findings from this research is going to be used to improve Miles for Migraine programming, as well as hopefully to improve the lives of people who experience migraine. Next slide. If you're going to participate, where do you participate? You can participate wherever you have Wi-Fi or internet service. It's just you using your phone. You can be in your living room, you can be out on a walk, you can be in a very private place, you can be in a public place. It's up to you. We don't meet face-to-face. All the interactions are virtual, and it's really wherever you feel comfortable. Next slide. The study is open between November 20th and May 31st. Each participant will take part in the study for 2 weeks. And during that time frame, we will select a time frame that is when you have a doctor's appointment. So you'll have a 2-week participation in the study, and your doctor's appointment is going to be sandwiched in there somewhere. And over that 2-week period, I will give you probably about 10 different prompts, and it would ask you to, like, hey, record a 2-minute selfie video of you talking about how it was to do X, Y, and Z, or record a 2-minute selfie video of the first time you had a migraine. And so participation would be say these 10 prompts, and there would be follow-up questions. Oh, you said you did this. Well, what was it like when you did that? And you would answer. So it's kind of like a text message exchange. And so I can imagine that participation for these 10 to 15 tasks or prompts would take anywhere between 10 minutes to 30 minutes. So it's not a big time commitment. But if you have loads and loads to say, you can take longer than that. So next slide. And what kinds of questions? Well, here's some. I'm going to ask you to introduce yourself. I'm going to ask, how does migraine affect your life? I'm going to ask, hey, tell me about your migraine elevator pitch. Maybe I'll have you read it, or not read it, but just say it into a video. And other questions, hey, you used your pitch. How was it? Talking to your healthcare provider about migraine. How was your appointment? And other kinds of self-advocacy. Because we're really trying to understand what is the role between self-advocacy and stigma. Everybody who's talked today has talked about stigma. It's a huge factor in this disease. And how do you prevent stigma? Well, stigma is a societal thing, so you can't necessarily prevent it, but you can put up a shield to it. And self-advocacy is one way that you can protect yourself. That's what we think. We want to find out more about that. So all of this is to ascertain, like, how is this working for you? Next slide, please, Greg. So who is eligible to participate? It's people who have migraine, who participated in one of the 2023 or 2024 Miles for Migraine Education Day events, so that would be you, as well as the people in Phoenix, and as the people in DC, and the people who participated virtually. Another criteria for eligibility is that you have a migraine-related healthcare provider appointment scheduled sometime between now and May 31st. 2024. Another criteria is, are you willing to reflect on these questions and share your thoughts and ideas through photos, notes, and videos? If you're a monosyllabic answerer, I would love to have more syllables. So, I want people who are engaged and who really want to share their thoughts. Another criteria is you have a smartphone and can install the app, which I would tell you later all about that. Next slide, please. Participation is voluntary. Your confidentiality and privacy will be safeguarded. This is not going to end up on the internet. If you are, very worried about it, we can blur your face on the video, but I would rather see your face. But I can understand if you don't want your face and me to see your face, because, like, I don't know, everybody's worried about data and stuff, data privacy. And participants can drop out at any time. You're not obligated to finish, but if you finish the study, you would be offered a $300 incentive by Miles for Migraine. And I had put $250 in the thing, but I think this is a nice incentive, and I bumped it up a bit because I want you to participate, and I want you to do it all the way through and really take it seriously and put your time and your mind to it. So I think that's the last slide. Oh, no. Okay, next slide. Are you interested in participating? If you are, speak with me before you leave. I'd like to ask that you add your name to this list that's already got about 5 people on here. Or you could take a flyer, and it's got my email address. You could also email me, anastasia@ethnolab.org. Or you can call me on my little cell phone, 215-823-0932. If none of that works for you, call Miles for Migraine and they'll connect us. Any questions? Anybody want to participate? Yes, yes, great. Okay, good. All righty. Well, last call for questions, although you can ask me later. But if you are thinking that you might ask me a question later, go ahead and ask it now, because there's probably somebody in Arizona who's like, God, I wish somebody had asked that question I have. Can you think of anything that might help those people? All right. Yes, thank you.
When you say an appointment with a healthcare professional, is it more helpful? Do you want it to be one where you're with a new professional, any appointment at all, a treatment? Like, is there that would be helpful?
Thank you. The question is, when I say that you have an appointment with a healthcare provider, is it a treatment, a new provider, somebody that you've seen before, any kind of healthcare provider? It would be a migraine-related visit. And I hadn't thought of a treatment, but I can see that you're not necessarily advocating for yourself when you get a treatment. You're just getting the treatment. I don't have experience in that department. Am I wrong? Do you do advocation for yourself, self-advocacy, or do you just get the, so it can be? Okay, all right, then yes, it would also include treatment. Okay. Any other questions that you think people in Phoenix or DC might have? No.
Is this timeline like flexible in terms of like if someone expresses interest today? Like I'm thinking, is the summer okay? Or
The ends in May 31st. So your doctor's visit or the doctor's visit needs to be by May 31st. Right, right. Because the reason we situated it that way, 2 weeks with the doctor's visit in there, is so that we can see how you advocate for yourself at the doctor's office. I mean, that's the most critical place, really. I mean, I don't know if it's the most, but it's a very critical place. And we're going to be talking about other instances where you advocate for yourself or that you present your elevator pitch, but it's important to have that doctor's visit in there. So this, I can imagine that we would do like an interaction right before the doctor's visit. Hey, your visit's coming up. Are you worried? Or what are you thinking? What are you going to do? And then afterwards, like, okay, your visit just ended. Please go immediately and answer these questions. Record a 2-minute selfie video. Maybe sit in your car in the parking lot and say, oh my God, I can't believe what just happened. You would never believe it. And just blab. It doesn't have to be, scripted or charming or articulate. It just has to be like your ideas and your thoughts and your experiences, like capturing what just happened from your perspective. So that's what I have to say about that. No other questions? Okay, thank you very much. Sure. I'll just pass this around to folks who said yay.
Remember, advocacy is part of your treatment plan, research included. Okay. I just want to say thank you again for hanging out this long. I know it's been a long day, and I'm sure we're all going to be going home and taking naps now. I want to thank our volunteers again, because you guys, Kelly, Diane, Katie, Deborah, and Tom, because you're a volunteer too at our races. So thank you for all coming here. And please go to our website, because we have other resources there that could potentially be useful. We do have a mindfulness for migraine program every other Thursday. It's free, it's virtual, and you might just really get something out of that. Check out our support groups, look at our new book, and we have an advocacy training program. We have programs for families with teens affected by migraine. We do have actually a teen support group called Teen Talks. We don't call it a teen support group because they don't want to hear that. It's called Teen Talks, and we're just here to support you. And check out our social events, because our social volunteer chairs here. Yeah, and we need volunteers, so go to our website and sign up to volunteer, and I hope to see you all at our next event. Thanks.
Thank you, Charlie.